fellow Facebook. Today we're joined by orthopedic surgeons, Dr. Matthew Hawkins, Dr. Hayden Box, and Dr. Josh Philbrook, who are all from Essex Orthopedics. And today we're kind of going to discuss bone and joint care. I'd like to remind our audience that Parkland Medical Center is only one of two Joint Commission certified for total hip and knee. So thank you so much again for joining us today. I'd like to start off with, in the environment that we're in with COVID-19 happening, I'm sure patients have their trepidations coming into your clinic, coming into the hospital. What are you guys seeing? What are you guys doing to help those patients understand?
It's an excellent question. Patients are certainly concerned about COVID-19, and it's a reasonable concern, but we're taking quite extensive measures to make sure that patients are safe and cared for appropriately, and they get home and don't get COVID. And so at our office, we're screening patients for any symptoms. All patients who come to our office are wearing masks. All staff members are wearing masks, and we social distance in the office, in the waiting room, to really keep patients as safe as we can, because our goal is to take as best care of you as we can.
And I know here at Parkland Medical Center, all the patients that are coming in are going through a thorough screening with a temperature check, and if they are getting surgery, they are also getting a COVID test done here, as well as all of our staff are wearing masks and proper, using proper safety distance. So I really now want to focus on each one of you guys, and that's why we're here today, to kind of talk about bone and joint. So if you could share with me, your areas of specialty and what you prefer doing. So, Dr. Hawkins.
Yes, hi. So I'm Matt Hawkins. I specialize in sports medicine. Sports medicine is probably the broadest of the orthopedic specialties. Pretty much anything from the shoulder to the knee to the ankle seems to be the three most common body parts that I treat. Take care of young athletes, team physician for Wyndham High School as well as Salem High School, and also consult with a lot of the local gymnastics clubs in the area. But it's not just young people. We wear and tear, and as we age, we tear things, rotator cuff injuries, meniscus tears, shoulder instability, ACL injuries. That seems to be the bread and butter, and that's what I enjoy the most.
Okay, thank you. Dr. Box?
Hi, I'm Dr. Box. I treat patients with basically who need a hip or a knee replacement. That's my specialty. So I can see it one of two ways. One way is that if you break your hip, for instance, and you are seen in the emergency department, then we would either think about a hemiarthroplasty or a total hip replacement. But most of my patients I see with chronic hip and knee pain, I see them in the office and they've got hip or knee arthritis, and at that point we talk about partial knee replacement, we talk about total knee replacement, or we talk about total hip arthroplasty. Some of the things that we do that not a lot of other groups in the area, we do anterior hip replacement, which is a minimally invasive hip replacement procedure to get you walking, moving as quickly as possible, and we're really doing quite a few partial knee replacements to take care of your pain, get you moving as quickly as possible as well.
Dr. Philbrook?
My name is Josh Philbrook, and my focus is the upper extremity. So basically anything from the fingertip to the shoulder and everything in between. We do shoulder replacements. If you have numbness in your hand, such as carpal tunnel, we take care of that. Thumb pain, indicating arthritis, take care of that as well. If you fall on the ice or break your wrists, I see that as well. So my focus is basically the upper extremity, and we enjoy treating all of it.
Which is kind of brings us to a great question. If somebody's to fall and have an accident and get hurt, or if they're just seeing kind of that routine wear and tear, what's the best way to get in touch with you guys or to get a consult?
So if you fall and you're in such a place that you can't get up and walk around, the first thing you want to do is call 911, and you can come to Parkland ER, where they have great emergency doctor physicians that can help and take care of you. Usually if it needs to be taken to the next level, they will give us a call where we can then come in and see you and take care of you as well. Alternatively, if you have something that's been going on for a little bit longer, say you have a sore knee or a hip or a shoulder, then you can give us a call at Essex Orthopedics. We have made it our goal to get people in within 24 hours. So we are easily accessible, and that's how you can get in touch with us.
So the patient falls, dials 911, comes to the emergency department. They do a great job there. I know all three of you guys are part of our orthopedic call team, which is great. They come and see you for a consult. Now they need surgery. Why is it you guys choose Parkland Medical Center to do those surgeries?
I mean, I think for me, the greatest thing about here is everyone works as a team. You've got great staff, great physicians. The communication is fantastic. If one of the emergency room doctors or hospitalist physicians has a question, they call me directly, and we get right to the heart of the matter. State-of-the-art equipment in the operating room, probably the biggest operating room I've ever been in. And any specialty equipment that we may need, it's never a problem to try to get it in and bring it in. So it's just a great team.
Plus, I know for recovery, all of our patients here at Parkland have their own rooms and our specialty surgical floor. So we have trained teams to work with them specifically for their bone and joints. So, we're still in beautiful weather here for fall, but we know what's lurking right behind us. As we approach the winter months, what are some of the things that your patients can do to help keep themselves safe and not have those falls?
It's an excellent question. So I see a lot of patients with broken hips, and as we get more snow and ice, it's going to be a bigger and bigger problem. So as you get older, your bone density gets lower, so avoiding falls is really important. So really ways to avoid falls when it's slippery and snowy outside is if you use a walker or a cane for stability, make sure that those are close at hand if you need to get up in the house or go outside the house. And also, don't be shy to call a friend or a relative to help you go to the grocery store or run errands if you need help, because we certainly we don't want you to fall. If you do, we're there to take care of you, but we'd rather you not fall in the first place.
So I'd like to remind everybody, if you have any questions or comments, you are more than welcome to post those on Facebook Live. Thank you so much to all three of you guys coming here and sharing your surgical specialty and expertise and knowledge of orthopedics. So that's been great. For more information, you can visit us at parklandmedicalcenter.com. Thank you.